Hi everyone, a little disclaimer. I am a physiotherapist, I'm not a doctor, and in my presentation I will show you my observation and research which I conducted about the subject which I will be presenting. So uh, there may be different symptoms. You always need to consult the medical professional if you encounter any of those. Hi everyone. Next part of neck injuries in Brazilian Jiu-Jitsu. This time we will talk about very complex issue involving arterial dissections which are causing strokes in Brazilian Jiu-Jitsu and MMA. Uh, in a previous video I mentioned briefly about arteries, about obviously discs, nerves, vertebra, etc. But very important issue, very important structure is artery. You've got vertebral arteries and you have also carotid arteries on the front. And they are responsible for supplying your brain, your face, your head, your neck, other areas with oxygenated blood. Unfortunately, there are more cases of strokes after jiu-jitsu, and I think in the literature it's only written about 4 cases. However, that's not the case, and I will tell you why. So I just created a quick presentation briefly about what are the different symptoms of arterial dissections and what that dissection is. Basically, I can explain you. Actually, we can see here it's a very rare condition. If we're talking about the vertebral artery dissection, it's about 1 in 100,000 cases, and carotid artery is 2.5 to 3 in 100,000 cases, and it usually involves young people, age between 15 and 45 years old. And the causes can be spontaneous. People can have predispositions to those arteries, and also traumatic, so whiplash injuries, car crashes, anything which involves extension of the neck, hyperextension of the neck, as well as maybe rotation as well. So uh, during traumatic injury like impact, strangulations, we call it chokes. In BJJ actually is a strangulation, and it happens in different sports. It's most observed in running, scuba diving, golf, martial arts, and there is a research paper written by European Journal of Stroke, and I can show you that it's quite maybe not common, but you can see that in all of the sports. And then just explaining about arterial damage. Usually what happens, the artery is like a pipe, consists of 3 layers, and the inner layer it tears during the impact and it causes flap tears. So that, let's say this is the inner layer, and it kind of opens up. So if blood comes through that direction, the blood comes in between that layer and causes big swelling, hematoma. At the same time, it restricts the blood flow to the brain. So then you can have signs and symptoms of those ischemic, which means lack of blood, lack of oxygen symptoms. And once that hematoma breaks off, maybe after training or maybe after the severe choke or chokehold, guillotine or whatever, or even rotation, maybe extension, that can be fatal. Unfortunately, we lost a friend to this condition, and it's very personal for me to talk about this. And the research from European Journal of Stroke shows that, if you can see here, we can check that research. It happens in water sports, like 26 reports. Actually, this was 190 cases written in 115 medical articles. So this data is collected from 190 cases of arterial dissection. So you can see scuba diving 14 cases, but if you can compare to running is 23 cases. I think my guess is because there are more people who run than more people who train jiu-jitsu or who do scuba diving or something. So combat sports 17, and jiu-jitsu is only, I can see 4 cases here. That was data from 2016 or 17. We can have some cases in judo, but as we can go on the bottom here. You can have skiing, you can have horse riding, for it's the same, yoga, skydiving, and you can have golf and football as well. So it can happen everywhere. If you're unfortunate and you miss the symptoms or signs, you can end up with a stroke. So going back to the presentation, apart from those written cases in jiu-jitsu, I spoke to Chris Martin, who is a black belt, jiu-jitsu black belt, and who suffered a stroke a few years ago after jiu-jitsu. He started his let me show you his website and blog, and he is talking about those cases. People started contacting him, and he counted around 100 cases of stroke after Brazilian Jiu-Jitsu, and I think maybe so. Those cases, 100 cases roughly, they've been reported to him by people who started contacting him since 2016. But you can read more about him and his blog in medium.com. He's got lots of interviews, and I talk about interview with incident that unfortunately we had with our friend. You can check him out. Big props to him because he's doing a great job, and they will be doing research, I think, with one doctor about those strokes, those cases. Hopefully I will participate as well, giving my information by permission of my friend's wife and family. So yeah, basically it's worth to check. So going back to the presentation, vertebral and carotid arteries. So you've got different signs, different symptoms. Early symptoms in vertebral artery dissections are neck pain and headache. The headache is described as no other, it's really severe. It's easily misunderstood with just a normal, maybe not normal headache, but result of some neck injury or something. And late symptoms, 5Ds. So dizziness, diplopia, which is double vision, dysphagia, difficulty in swallowing, dysarthria, problems with speech, and drop attacks. So you can have, you can faint, you can have those attacks as well. 3 N's, nausea, so you feel sick, nystagmus, involuntary eye movement, and numbness on the same side of the face, I think the same side of the artery. 1A, ataxia, lack of voluntary coordination of movement. So you can have a limp, you may not be able to lift one arm the same as the other. Those are the symptoms, but Other symptoms are associated usually with symptoms of stroke, which we always talk about. More of those symptoms come from carotid artery dissection, the one on the front, and they can be sometimes misleading because the vertebral is a little less common, but you can still um, have those incidents. What worse, that artery splits and it supplies brainstem. So if there is a blood clot and it's not dissolved in time, that can cause the switch off or of all your vital functions of the body. Uh, Early signs for carotid artery dissections or dysfunction is mid upper cervical pain. Cervical is neck. Carotidynia, which is pain in the front of the neck, sometimes feeling of tonsillitis. So, like you try to swallow, you feel something's there. You may feel like tonsillitis, sore throat, um, head pain in that part of the body, frontotemporal parietal area. Also, very severe headache. Ptosis, which is falling of the upper eyelid. This is like you can see someone is, his eyes here are kind of unequal, and you can have a drop of this eyelid. Lower cranial nerve dysfunction, phase drop. So the same. So you may have a phase drop, different asymmetrical phase, and headache, unlike any other. So those are kind of most of the symptoms. Uh, Late signs, transient retinal dysfunctions, which is blackouts, blur-outs of vision up to 15 seconds, or clouded vision. So we had in the vertebral artery, we have diplopia, which is double vision. Here you have a blur vision, blackouts, blur-outs. Transient ischemic attack, more for the doctors, and cerebrovascular accidents, which is basically stroke that can result in stroke. So for this is good to remember to memorize face, arms, stability, talking, eyes, reacts, which is faster, acronym faster. So face drop, unequal. Arms, maybe ask them to lift the arms, maybe one can go lower, the other higher. Also stability, the gait, we said, the unstable walk, maybe limp, maybe something weird. Talking, if you ask them to talk, they may speak like a drunk, or you may not understand them, and that's really good sign as well. Eyes, one pupil may be diluted, the other one not. So one can be the black part of your eye can be bigger, the other one can be smaller. And R is react, just call ambulance. They may be fighting with I didn't drink water or something, or I'm tired. But if you notice, just look after for your friends. Those symptoms may occur 2 weeks or a month after injury. So some of them can be rapid, but some of them can last for weeks. Like in case of our friend, he had some headaches apparently, and they may not present at the same time. You don't expect all of those symptoms at the same time. Maybe they will come together, maybe not. Maybe there's going to be one or two signs and symptoms. So please pay attention, especially after chokes, strangulation, guillotines, hard sparring. If someone faints once or a few times, you need to be really careful. If you suffer similar symptoms, maybe it's good sometimes to ask a family. Maybe you will not notice that your speech is different. You will try to speak, you think you're speaking clearly, but your wife or your mom or your friend, they can tell you, listen, there's something wrong. Listen, better go to hospital and get yourself checked. So I send you to Chris Martin for more information about that. And if you or your friends, if you encounter them having
stroke after jiu-jitsu. Maybe they want to they want to participate in the research. So I'll send a link below, but you can see it on the presentation. Is medium.com, and yeah, props to him, because actually thanks to Chris, I kind of opened my eyes to this issue. Thank you, and speak to you soon.